A warning today from infectious disease specialists about dangerous viruses going around.
As more of them continue to spread, health anchor Liz Bonus joins us now with why it's so important to know which ones really can make you really seriously sick. Liz?
All right, guys, thanks. Good afternoon to you, and good afternoon to you. As cold and flu viruses begin circulating in our community, there is a new warning from infectious disease specialists about protecting against them. While most of the time we think of them as harmless, one of the main reasons the flu is so dangerous is that it can lead to pneumonia. Specialists at the Cleveland clinic that supplied this video say they also have concerns about many of the viruses that are hitting children right now especially hard. The CDC reports the flu was responsible for 186 pediatric deaths during the 2018 school year. When it turns to pneumonia, it becomes a dangerous lung infection. That lands approximately 1 million people in the hospital every year. But many other illnesses such as whooping cough, croup, and RSV, or the syncytial virus as they call it, respiratory, can be very dangerous for kids and even for some adults. Now, these can block breathing. Infectious disease specialists at Cincinnati Children's Hospital also say the vaccines are the best way to protect against them, and they are continuing to try and improve those, especially when it comes to the flu.
The ultimate goal for the NIH and for us is what's called a universal vaccine. We would like to give one vaccine that would protect against all strains. So if we give you a vaccine this year, the virus changes, that vaccine will still work. 3 years from now, if it changes some more, that vaccine will still work. But there's a lot of efforts. We're doing a couple of studies here aimed at that goal. That's the ultimate goal.
That's Dr. David Bernstein. He has been at Children's for almost 30 years and followed, the changes and how much better. He said we still are hit or miss. That's why they're working on the universal vaccine. Okay. But he's also part of a trial that they are now paying people to give you a low dose of the flu. They put you up in what's the equivalent of a research center hotel. Okay. You stay there for 10 days. And tonight at 11, we're going to introduce you to some people that are doing that this week, all for a good cause.
They're brave.
They pay you?
Yes, they pay you.
I think I would do that.
Really?
Oh, I would.
So that's always the question. It's not really, it's like minimum wage, but you're there 10 days, so it adds up. But the question is, would you get sick? Usually you're like, I'd pay not to get sick.
Right.
They're very careful. Only healthy people can do it. But watch tonight at 11. We'll tell you about it. I know you'll be here for that. And it's a very interesting, and they're looking for people for December. So I'll give you a number for that.
I've been in